Hello everyone, it's your girl again, Jemima. If you're new to this channel, I am a clinical dietitian. Thanks for tuning in to Smart and Healthy Lifestyle. Today we are going to explore a very important, a super important topic for every parent. Guess what? Yes, you're very right, diarrhea in babies. At some point, many parents may face it, and I feel like me, as your superhero, should give you some nutrition tips and tricks on how to navigate through it. Stay tuned. So, first off, diarrhea is when your baby passes frequent loose or watery stools more than usual. It can be more than 3 episodes per day. It can range from mild to severe and can be acute, that is lasting for a few days, or chronic, lasting for weeks or even longer. Now, I'm not talking about the typical baby poop that can vary in textures. It's something that is sudden, a sudden change where the stools can be more liquidy, and yes, it can get a little bit messy. So let's get interactive. In the comment, drop an emoji or a word for what you think is the most common cause of diarrhea in babies. While you're thinking about it, I'm here now to give you the main causes of diarrhea in babies. First will be infections. We are talking about the notorious ones like the rotaviruses, the bacteria like E. coli and Salmonella, and some parasites. Sometimes your baby is trying out new foods and their tummy is not happy, or they may develop food intolerances or food allergies. The third one will be antibiotics. Yep. Those meds that save the day, sometimes they can mess up with your baby's gut flora, causing what? Diarrhea. Signs to watch out for will be like watery stools, of course, but also pay attention to other signs like crankiness, vomiting, or dehydration. Dehydration in babies can be serious, so keep an eye on things like the dry mouth, sunken eyes, or wet diapers. If you're sensing like your baby has some signs of dehydration, that is a cue to call your pediatrician right away. The big question is, what do I feed my baby who has diarrhea? And that's where I come in. Nutrition is very important, plays a huge role in helping your baby to recover from diarrhea. First and foremost, hydration is key. Giving more fluids can be life-saving. If your baby is on exclusive breastfeeding, breastfeed more frequently and longer at every feed. Breast milk is like your superhero. It has everything that your baby needs to stay nourished and hydrated. In addition to breastfeeding, you'll also give oral rehydration solution, or what we simply term as ORS. It is perfectly packed with a balance of electrolytes, sugar and salt, which will help them rehydrate, of course. So for babies who are not on exclusive breastfeeding, you continue feeding either with your formula or other solids as normal, but make sure the solids that you're giving are gentle on your tummy and are easily digestible. So you can give fluids like the soup, the rice. You can also give white bread. Make sure you're also giving probiotic-rich foods like the yogurt, the plain yogurt, the kefir, or the fermented porridge, which will help to restore your baby's gut flora. Do not forget about the clean and safe water. If your baby is vomiting, as we've seen earlier, if your baby is vomiting, you wait like for 10 minutes and then give sips of fluids. Again, this is not the time to give foods that are too much in sugar, like the fruit juices. You will also have to hold off some spicy or high fatty foods until your baby is able to tolerate them. And of course, prevention is better than cure, right? So you make sure you're practicing hand washing tips, like now washing your hands before and after changing the diaper or before feeding the baby. And don't forget that vaccines are your baby's best friend. If you've not taken your baby for immunization, kindly do so. Let them get the vaccine against the rotavirus. Like now we have the rotavirus vaccine, of course. But of course, I also want to hear from you. Let me know at the comment section what tips works for your baby best when they have diarrhea, or what superfoods or hacks you do there at home when they have. Thanks for watching. Remember, stay calm, stay hydrated, and keep those baby smile going. Don't forget to hit the subscribe button and the notification bell if you want to learn more on this channel. See you till next time. Happy feeding.